the opposition voted against all of this. The opposition voted against all of this, perhaps unsurprising given it's an opposition led by a man who was health minister, actually tried to jack up the price of medicines, not to bring them down in his first budget.
My question is to the Minister for Health. What actions has the Albanese Labor government taken to make medicines cheaper for all Australians? How are 60-day prescriptions helping patients with ongoing illness? And why wasn't this introduced earlier?
Call to the Minister for Health and Aged Care.
Well, thank you, Speaker, and I thank the member for Hunter for his question because, like everyone on this side of the House, he has no higher priority than helping his community with the cost of living by earning more and by keeping more of what they earn. I'm pleased to say, Mr Speaker, last year healthcare workers saw their wages rise by an average of 5.5%, well over double what they were seeing under those opposite. And they'll get to keep more of that money, Mr Speaker, when every single one of them receives a tax cut on the 1st of July. Like a third-year RN in the member's electorate working at the Cessnock Hospital who get a tax cut of more than $1,600 or double what they would have got under the old plan. But the member for Hunter also promised cheaper medicines to his community, Mr Speaker, and we have delivered on that as well, like lower annual medicine bills for millions of pensioners and the biggest cut to the price of medicines last year in the 75-year history of the PBS. But we've also been determined, Mr Speaker, to allow hundreds and hundreds of common medicines for ongoing health conditions to be supplied for 60 days at the cost of a single script, saving up to 6 million patients time and even more money, Mr Speaker. It's not a new idea. Most other countries we compare ourselves already do it, and the medicines experts advised the former government to do it more than 5 years ago, Mr Speaker, but they rejected the advice, and instead millions of patients have paid hundreds and hundreds of millions of dollars for their medicines, more than they should have done. Well, we did accept the advice, Mr Speaker, and 3 weeks ago I added 94 more medicines to that 60-day script list, like menopause medicines used by about 600,000 Australian women, like diabetes medicines used by well over 1 million Australian patients, and medicines used by tens and tens of thousands of breast cancer survivors to prevent a recurrence of their cancer, just to name a few, Mr Speaker. And remember, Mr Speaker, the opposition voted against all of this. The opposition voted against all of this, perhaps unsurprising given it's an opposition led by a man who was health minister, actually tried to jack up the price of medicines, not to bring them down in his first budget. But I don't only want to thank the member for Hunter for his support and commitment to cheaper medicines. He has also been a fierce advocate for a strong community pharmacy sector in the Hunter Valley, Mr Speaker. And I know that he's delighted that we've reached a deal to invest up to an additional $3 billion to deliver cheaper medicines, to deliver better patient outcomes and a strong community pharmacy sector. Now, those opposite pretended you could only have one or the other. You can only have cheaper medicines or a strong pharmacy sector, but our negotiations have delivered both. That's what a strong, responsible government does.